Yeah, so thank you guys for inviting me to speak about one of my favorite topics, foaling. And as Candace described, my practice is in Virginia. So we're in Rixieville, but my basic practice is ambulatory, so I'm all over kind of Northern Virginia. So this is a little barn that we have that I do haul-ins, as well as that's where I do my in-house breeding management and fresh, cooled, or frozen. And then we have a bunch of tanks over here with quite a few Hanoverian stallions in there, I might add. And then our breeding stocks. I think Candace is going to manage questions and so forth, but this is my email address. If anyone has specific questions, I'd be happy to respond. Okay, so to get a healthy foal on the ground, we really need to start with a healthy mare, and that really starts with her health before breeding. But kind of in our top picture, if we're hitting this time of the year and we've got, you know, a field of pretty relaxed mares that will hang out like this group of thoroughbred mares here, I think you've gotten that goal accomplished. And if you can start with the mare that like that, then you should have a healthy, happy foal as pictured here. And again, maintaining good health of the mare before breeding through the pregnancy gives us the most optimal chance of having a healthy foal at delivery. So my goal is to really go through the normal foaling process so that you can recognize things are normal, and then when things are not normal, and when to call for help. And so to that end, we need to start off by really describing, you know, what's normal about pregnancy. And the first of that then would be the length of the gestation of the pregnancy. And in the mare, which is very frustrating, the length is quite variable with that individual, and there are some seasonal effects. I figure due dates out at 335 days from ovulation, which is a little over 11 months. The average is about 340 days, but a range of normal is 300 to 355 days, hence the frustration. We need to kind of define what a premature foal is, and because in doing so, we can recognize this is an individual that needs extra care. So our premature foal is a foal born gestational age 300 to 325 days. And the presentation of this foal might include a weak foal, one with a domed forehead, soft lips, a deep red tongue, floppy, very pliant ears, which would just mean there's not a whole lot of muscle tone, tendon weakness, a decreased, or sometimes you'll see a normal suck reflex, but it can be decreased. A low birth weight, respiratory difficulty, so you'll kind of see rapid breathing, pretty nonstop, a bloat or colic, especially after nursing, low body temp or of not having the ability to regulate the temperature, and a short, silky hair coat. So when is that mare ready to foal? And that's probably the $50 million question for all of us who have been up many, many, many nights in a row trying to make sure that we're there for the big event. So all of this is triggered by the foal's readiness for delivery. And so that foal then kind of signals changes in the mare. And the first of those is udder development. And so that those mammary glands really start to develop about 3 to 4 weeks prior to foaling. That udder should be full 48 hours prior to foaling. There'll be a little bit of wax at the end of the teats about 12 hours out on average, and some mares may actually start dripping milk 4 to 6 hours prior to foaling. Now, this photo is a maiden thoroughbred mare who was just a few days before she actually foaled, and you'll notice that her udder isn't really huge, but it's kind of tight, but it's definitely there. But her teats are they're not straight up and down yet. They're still kind of pointed towards one another. So So in a maiden mare who doesn't really know what to do, I'm going to keep a close eye on that mare, but I'm not thinking she's likely to foal that night. Contrasting, this is an experienced mare that's had several foals. I happened to be on the farm and get this picture in the morning, and she foaled that night. So looking at her udder, you can see that the udder is rather full, the teats are full, and there's actually a bead of wax on the end. And this is a pretty extreme example, and many of our mares don't quite get like this, but this is kind of your definition of a well-waxed up mare. So this udder is full and tight. The teat is very distended. There's a large bit of wax here, but there's actually this waxy substance kind of between the two mammary glands as well. Another thing that we can see is a development of ventral edema. So this is the most dependent portion of the mare's abdomen, and there's just this plaque of kind of firm fluid that goes all the way back to the udder, as you can see in this picture. Some mares will develop this close to the end and then maintain it kind of for a week or two after they foal. I've had some of them have this edema actually go up towards between their front legs. Tends to not be a big problem, but I'll have to say I keep an extra eye on these mares when they do this. So the other physical change that'll happen is relaxation of the hip musculature. And again, all of this is in preparation for allowing that foal to come through the pelvis. So you'll see the muscles starting to soften near the tail head about in the last day to 2 days before foaling. And it really looks like a softening and a sinking in and around the tail head. And what I like to do in the last couple weeks is kind of put my hand underneath of the dock of the mare's tail and just kind of hoist it up a little bit so that I know what kind of the tone feels like. And so what's normal for each individual mare. And then when I start doing that and I can easily flip that mare's tail up, that means we're really starting to relax. The other thing that we'll see, so in this picture, this is that maiden mare again, who was a couple days from foaling. So this is a very normal vulva. This is her seat bones in this area, and her vulva is just small with no swelling, and it's still pretty tight. This will actually relax and lengthen, and you might even see some edema in the bottom of the lips there. The other thing, a lot of mares will go off of feed the last little bit before foaling. Sometimes it's just the hour before. So this picture is actually a mare in really good body condition. How prominent her top line is from the top of her pelvis down towards her tail makes you think that she's thin, but she's actually not. This is basically your description of how the muscles have really relaxed. You're talking about sinking. So she is really, really soft around her tail head. That vulva is long and edematous at the bottom. So a lot of estrogen here, a lot of relaxation in that pelvis to prepare for that foal. So this mare kind of looks like that foal could fall out at any moment. And then getting ready for that mare to foal, again, the mare needs to be really healthy, and a lot of these guidelines you're going to set with your individual veterinarian and your management scheme. But the pre-foaling vaccinations need to be administered to the mare about 30 days prior to that expected due date. We need to remember that that foal has basically no immunity at all until after it's delivered and it starts nursing from the mare and getting that good quality colostrum, that first milk from the mare. So 30 days out, she's going to be vaccinated. You're going to also need to prepare a clean foaling environment. So a 12 by 12 stall can be fine. Frequently, we'll have a lot larger stalls. And it's just interesting to me how no matter how much room you give these mares, they like to foal up near the wall. A bigger stall is a whole lot more to clean. But you need to, based on the size of your mare, just provide enough room for her to be comfortable. So that stall needs to be clean, dry, no water from the outside leaking in, and free of drafts, and well bedded. So when the mare's ready to foal, I like to have sawdust or some kind of really good dry bedding down, but straw on top. So the straw is really preferred because it insulates the foal to keep them warm. That probably the best of all the beddings, but it also, that fine particulate matter can actually coat the foal's face, and a foal that's not really strong, you might actually occlude his ability to be able to breathe with that fine bedding. A pasture or paddock that's clean and kind of protected from the weather is fine too. We just don't often get these mares to foal during the day. They like to do it in the middle of the night, the wee hours of the morning. And so the stall is a protection for them, but convenient for us as well, to better be able to take care of them. If you've got multiple mares foaling, you really need to pay attention to disinfecting between the mares foaling. So that really means scrubbing off all the dirt in the stall and the manure on the walls and the floors with a detergent, and then coming back after everything is clean with bleach or another disinfectant. The other thing is that you want to really make sure that that area is safe for an unsteady foal, a curious foal that's going to kind of put its mouth and get into places that an adult won't. I suggest kind of getting down at the level of the foal and kind of looking up and around the stall to make sure you don't find a trap. You've got an automatic water in the stall. Is there anything sharp or anything that foal can get caught up underneath? So if the mare's had a caselix procedure or suturing of the vulva performed after she was bred, then we'll need to do an episiotomy about a week or so prior to foaling. Some people recommend doing this at the pre-foaling vaccine visit. I like to wait till the udder's full or about a week before her due date to do this. So opening the caselix, this episiotomy is also called opening of the mare. We do that with a local anesthetic block. And so basically the tissue of the vulva that has grown across is cut open so that that foal can be delivered without tearing the vulva. If she's ready to foal, she's going to foal regardless of whether or not that caselix's been removed, but it tends to be a pretty significant tear in the vulva if we haven't opened her ahead of time. Another thing that may need to be done about 3 weeks before your due date is a blood test to determine if that mare has antibodies against the foal's red blood cells, or an NI screen, neonatal isoerythrolysis screen. This is more common in certain breeds or certain pedigrees within a breed, like in standardbreds and Tennessee walking horses. We've kind of seen these problems. So again, this NI screen is a test for neonatal isoerythrolysis or jaundice foal. It might remind you of Rh factor incompatibility in humans. But in my practice, if I've had a mare that's ever produced an NI foal, we're going to do a screen every year, and we may end up managing that foaling situation to prevent the foal from nursing the mare. But again, all of those things, something you would discuss with your veterinarian. Trying to predict, again, when she's going to foal. There's several pretty good predictor kits out there. These are all based on their water hardness test. And so when you do these water hardness tests looking at the mammary secretion of the mare, they're going to let you know when the electrolyte content changes in that secretion. So particularly we're looking for a rise in electrolytes or a calcium particularly. And the rise in calcium is very highly correlated with the fetus's readiness for delivery and knowing that we should be within that 24-hour window of delivery. So probably the best kit on the market is the Foal Watch kit that's made by Chemetrix Lab, actually local to me here in Calverton. But Soft Check and some of these other water hardness kits also are help. So these kits, basically you take a bit of mammary secretion, you dilute it with distilled water, you add a drop of a reagent, and then you're looking to see the color content to tell you color change, and that's your change in calcium content. And again, there is a very pronounced rise in calcium in the last 24 hours before the mare foals. And I'll start testing these mares when the udder's full. So these slides, so this is that Foal Watch kit. These are two little Dixie cuts of the mammary secretion of the mare. And certainly when you look at these example here, you see this one's clear and that one's cloudier, looks more like milk. You would think that this mare was actually closer to foaling. That is not always the case. You can have a secretion that looks like this, have a really high calcium content, and that mare is ready to foal. So this photo is actually of one of the other strip water hardness kits. These strips are 4 green squares here, and you basically, it's still the secretion diluted with distilled water. You put the strip in, then you let the strip dry for 1 minute exactly, and then you look to see how many squares have turned pink. When all 4 squares have turned pink, that mare is 95% likely to foal within 24 hours. This is what the Foal Watch kit looks like. This one has taken a lot of dilutions. You're basically suctioning up into this glass pipette from your mix that you've made up with mammary secretion, distilled water, and reagent. And this one is taken quite a bit to get, and it's only like 100 and some parts per million calcium, where this hasn't taken very much to have that color change to blue. This one was over the 250, and so that's our magic number. This is a mare that we're going to watch to foal within hours to that night. A mare does this, you're not going out to dinner that night, you're staying home to watch her. So supplies that I would recommend that you keep on hand. So you need your veterinarian's phone number. And I would also say if you are doing any of those predictor kits and it says your mare's going to foal in 24 hours, I tell my clients, give me a call, let me know that that's happening. That way I can be, in the middle of the night, kind of as I'm blary, knowing which direction I'm driving that night if you need help. So keep us informed, and that way we're, the best able to help you. So veterinarian's number where you don't have to look for it, towels to dry the foal off with, a tail wrap to wrap the mare's tail to keep her tail dry and to keep her tail out of your way. You can use an ACE bandage or vet wrap, brown gauze, anything of the sort. A navel dip, we'll talk more about that later. Fleet's enema or some generic form of a saline enema, a string to tie the placenta up out of the way, a collection cup if you're going to bank colostrum, and I would recommend you do that if you foal several mares. Phone numbers of other help that's needed. Certainly it's better to have more than one fully functioning adult body if you need help. And if you have help lined up ahead of time, rather than calling somebody at 2 in the morning, always helpful. Blunt banded scissors. I like to keep blunt banded scissors hanging right outside that mare's stall. So this is kind of our list. So here's our navel dip. I like to use, this is a 6 cc syringe case that I will fill up, and it very nicely will cover the entire umbilical stump without disturbing the skin. Vet wrap, ACE bandage, brown gauze that can be used for a tail wrap. These are bandage scissors that I'm talking about with a blunt end. Just a little rope to tie up the placenta, soap that you can wash the mare off with, and then this is a generic enema. And again, this is an adult size enema. So again, in our efforts to know what is normal so that we know when there's a problem, knowing the stages of labor and the delivery process itself. So the first stage of labor is actually when the uterine contractions are beginning. And this is when the foal is actually moving into foaling position. And proper foaling position is the forefeet first and then the nose behind it. So this stage is the most variable and it is under the mare's control. She's a prey species, and so if something is wrong in her environment, she can stop this process until things are safer. What you'll see the mare do when she's in stage 1 is just becoming restless, which for some of these mares is doing a lot of pacing. You may see what looks like mild colic symptoms, frequent small urinations, defecation, so she'll pass just a little bit of manure and just keep passing little bits of manure. She may sweat. You may see her yawning or doing that flamen response. She may bite at her flanks. Frequent laying down and getting up. That's probably our most common symptom that we see. And again, stage 1 labor, it might last 1 to 6 hours. She can completely stop and go back to eating and ignoring and go out of this stage of labor, or it may progress. But stage 1 labor ends when she breaks her water, or the rupture of that chorioallantois part of the placenta, when that is being forced through her dilated cervix. So that second stage labor is when the foal is in the birth canal. The amniotic sac allantoic sac has ruptured. She's having abdominal contractions, trying to push that foal forward, and it concludes with the expulsion of the foal through the vulva. This can take anywhere from 5 to 60 minutes. We certainly like it to happen in 30 minutes or less, but this is our critical time. This is where we and I would also recommend that if you don't write it down, you look at the clock, because when you're watching a mare in this stage of the labor, what might be 3 minutes seems like it's an hour. I think we're all anxious at this time, but having kind of defined objective clock numbers can be helpful. We really don't want there to be much more than 10 minutes from the time that the mare has actually broken her water and that we start seeing some portion of the foal, either just the amnion itself or the forefeet nose. I would consider it an emergency if you see a red bag instead of that white glistening sac of the amnion and the foal feet. If it has been more than 20 minutes from the water breaking to anything appearing, or if you see that it's not the right part of the foal coming forward, or 20 minutes of active straining and pushing with absolutely no result. All of those reasons are reasons to call. So this is what you should see. So this is our white glistening sac of the amnion. This is a foot with the toe pointing downward. You can see this is the amber colored fluid. That's what the allantoic fluid looks like. It kind of looks like urine. A lot of times we don't really notice when the mare breaks her water, but we'll think she's peeing. That's what this fluid is here in the straw. Good reason to keep this tail wrapped. Again, you can see what's going on without having to get in there and fussing with the mare, but also there's just so much fluids we can help keep her clean. Okay, so here is the picture to keep in mind about an emergency. So if you see this, you need to get somebody to make a phone call to your veterinarian, but you are going to pick up your blunt bandage scissors. You're going to poke into this red bag, then you poke a hole into it, then put your fingers in and rip it sideways. And then you should see that white sac, and then you help deliver that foal. So when you see this means that we call a red bag also a premature separation of the placenta. So this means that a portion of the placenta is no longer attached to the uterus. It's no longer having the nutrient and oxygen exchange. So there could be compromise to this foal, or if we deliver the foal quickly, it could absolutely be fine. But many mares absolutely cannot get that foal out through this thick membrane without assistance. So I don't want to scare anybody, but when you see this, you need to call for help, but you need to act. So our third stage of the labor, this is actually very important because this is all about the health of the mare and the possibility of getting her bred back the next season. So the third stage is actually the passage of those fetal membranes or the placenta. We also call this cleaning. So this usually occurs within 1 hour. Some mares will drop that placenta right on top of the foal, but it really should occur within 3 hours. And so a placenta that is not cleaned within 3 hours is considered a retained placenta, and veterinary care or consultation should be sought. If you've got a mare that has retained a placenta one pregnancy, you need to be prepared that she might do it again, and maybe discuss with your veterinarian keeping oxytocin on hand or what protocol you want to have in place. When she passes that placenta, you want to remove it from the stall intact, save it in a bucket or a trash bag so that it can be examined by your veterinarian. Keep it away from the dogs and the barn cats so that we can get a full examination without kind of their artwork added. So again, a review of that birth process. So the foal should arrive through the mare's vulvar lips with the forefeet and then the nose. That glistening white amnion may be covering his nose, and it should be opened if you get the legs out pretty far and his nose is out and it hasn't broken open itself. You can certainly kind of rip that with your hands. The shoulders tend to be the biggest obstacle for the mare, and she'll frequently struggle trying to pass. I don't mind putting my hands on those foal feet, and when the mare is pushing, pulling just to help her a little bit. A big thing I'll tell you is that when the mare's, you know, the head's coming out and so forth, you don't always see movement. You don't see that full breathing. This is something you need to say over and over again to yourself. You need to remember that that foal will not breathe on its own until its chest is clear of the mare. He cannot expand his chest until he's outside of the mare. He's breathing basically through the intact umbilical cord. He's still getting oxygen from her that way, but it's a frequent kind of source of panic that the foal's head's out and it's not breathing. You don't see the nostrils moving. That's normal. That foal cannot breathe until his chest is outside of the mare. So the foal is out on the ground. The mare's laying in the stall. I like to let them sit here for a couple minutes. So here's an umbilical cord. This is a foal of mine that was born in June in the middle of the day on a Sunday. Wasn't this nice? But anyway, I'm going to let this mare sit here quietly. This umbilical cord is still attached between the two of them. I don't interfere at this point. I want to let nature take its course. So there can actually be 6 to 8 liters of oxygen-rich blood still going from that mare to that foal, and there's no reason not to deprive that baby of that. When the baby kicks or the mare gets up, that's when that umbilical cord will break where it's supposed to. The only time I tend to break umbilical cords themselves is if the mare's dropped the placenta before it's had time to break, but you can get instruction on that. So the umbilical cord is very important for to understand in regards to the foal's health. And so this is a really old diagram from when I was in veterinary school. The foal's head's on the left, the tail's on the right. This is the umbilical stump here. It's really important to understand what the umbilical cord, where the portions of the remnants of the umbilical cord go to. And so there's one umbilical vein that goes to the liver. There are 2 umbilical arteries that go beside the bladder. The bladder is here. There is this space between those 2 umbilical vessels called the urachus, which was the fetal bladder. So the foal was basically urinating into this urachus out through the umbilical cord, and the mare was eliminating it. So important to note that this attachment is at the bottom of the bladder, and it's kind of a weak point. But again, umbilical vein to the liver, and then 2 arteries toward the bladder. So the importance of the umbilical structures. So an improperly dried and disinfected navel umbilical cord can be a wick for infection into the foal. Urine leakage or a patent urachus is a symptom or a cause of infection of the umbilical structures. And the anatomy of these structures show that a problem here is rapidly spread throughout that foal's body. So again, the navel or the umbilical stump contains 1 umbilical vein. That vein goes to the foal's liver. All of the blood in the foal's body circulates through that liver. What we're trying to avoid is bacteria ending up at growth plates or joints in the foal. There are 2 umbilical arteries, again, that go to the bladder, and then that urachus or that fetal bladder. So this actually closes, the urachus closes upon rupture of the umbilical cord, but it does leave a little weak spot at the base of that bladder. So that's why we don't like to grab the foals around their belly. If there's a full bladder, we put pressure around the belly, we can actually cause a rupture through this weakened spot. So our best navel dip, based on a lot of years of research, is a 0.5% chlorhexidine or Novocaine solution. Iodine has certainly been something that's been used many, many, many years, but we want that percent of iodine to be at 2%. When I was first in practice, it was pretty common for people to use really, really strong iodine. That actually is not preferred. They tend to be too irritating to the full skin, and it isn't actually preferable in trying to disinfect that navel. So I like to dip that belly button twice a day for the first 3 days. And again, I'm using my 3cc syringe case. But something a little bit cylindrical like that is really nice because it can coat the umbilical cord and circumference 360 degrees around that cord really easily. So the foal's out, the umbilical cord's broken, you've dipped the umbilical cord, you should be tying up the mare's placenta. But at this time, she is going to be licking that foal, and she's licking that foal. She's stimulating blood flow. She's trying to clean that foal off. It'll help to stimulate regular breathing in the foal. But it's also the beginning of that really important bonding process that the mare has with her own foal. And because of that, you need to be careful that there's some mares who will be fine 1 minute and they get very aggressive and very protective the next. So just always kind of keep an eye on your mare. I like to keep halters on my mares when they foal, just in case I've got one that'll turn dangerous in a minute. This really sweet Palomino mare was one of those who would do that. She was fine here, but about 6 hours after the foal was born, she would turn aggressive. And that would last about a week, and then she was fine. But all to this end, this is when it's really important. This is frequently if we've got friends, children in the neighborhood, whoever that want to visit, they want to see this. You know, this is a special moment with the mare and the foal. But everybody needs to be quiet. You know, if there's a lot of disturbance going on, you can actually get the mare fairly frantic at this point. So we want things to be quiet in the barn at this time. We want the dogs and the cats kind of out of the stall. But if the mare's pretty relaxed and happy to have you, this is a perfect time to get in there and start drying that baby off and help her stimulate him breathing and all of his neurologic milestones. So this is just a photo of a placenta tied up. I actually take the amnion, that white portion, and I just try to make knots out of it. And then I will use baling twine and just keep tying the placenta to itself. What I want is to try to keep the placenta at the mare's hocks or higher so that she won't step on it and tear it. I want the weight of that placenta to kind of help be gravity pull for her to drop it on their own. We don't like to pull on that placenta to get it out. We want it to kind of go on its own. So now the foal's sitting on his chest, kind of looking around a bit. Maybe he's thinking about standing, or he's just not making progress to stand. This is when I like to then give that foal an enema to make sure that I can get rid of the meconium stools that are kind of stuck in his belly. Or frequently when you get that foal to start defecating out that meconium, they'll get a whole lot more motivated to stand. It's like makes them a whole lot smarter to kind of get rid of all that poop, and they'll be more aggressive about nursing. So these again are adult fleet enemas. They're saline rather than a phosphate enema, but phosphate enemas are not a problem. That it has a soft lubricated tip. It just goes straight into the anus of the foal. You squeeze the entire contents in. And then I like to wait. If it's 5 or 10 minutes, we should start seeing some production from the foal. If we don't, I'll either give another enema, or I will. These are nice because you can unscrew the top and put warm water back in. That actually brings another point. I like to keep, once that mare foals, I put these enemas in hot water because I warm water is always better going up the butt than cold water, I would imagine. So meconium is thick, it is sticky, and it will dry out really quickly. So this obviously is on a towel outside of a stall, but imagine this kind of gumming up the foal's GI tract and keeping and causing an impaction. You know, that's actually a pretty serious problem. So again, these meconium or these first stools should start to pass within the first few minutes of birth. But certainly once that foal gets up and starts walking around, he should be motivated to eliminate. So again, it's dark, it is very sticky, and if all the meconium isn't entirely eliminated, it can cause a problem. This is just a drop in the bucket of what this foal has. I had a foal who, the quarter horse foal, who was about 38 inches at his withers. He dropped 2 piles of meconium that were like 2 8-inch dinner plate sizes. So there's 11 months worth of this material. So if you see these few little drops, he started to pass meconium, but don't think that it's all passed. You need to monitor that foal, any straining to defecate or urinate within the first several days. Sometimes you'll have to repeat enemas if there's any issue with meconium retention. So a couple parameters to keep in mind. You should see a good suckle reflex on that foal 2 to 20 minutes after delivery. They will suck on anything, not necessarily the foal's udder. If you touch that foal's face, they'll try to be sucking on your finger or your hand. If you see that, you should be happy. You know, that's one milestone that's very positive. Time to nurse. We really would like that foal nursing by 2 hours of age in order to make sure that we can start getting those immunoglobulins in that foal, but we also want to get some calories in there. We don't want that foal to start running out of energy. More than 3 to 4 hours after foaling, I would consider that an abnormal time frame for the foal to nurse. So if we're at 2 hours and that foal is not nursing on its own, I am milking that mare myself and I am feeding that foal something. And frequently, if you do that, they get a whole lot smarter about finding it. They kind of get a taste of what they want, they smell what they want, and they get more aggressive about going to get it. You should see that foal standing about an hour after delivery, but really making concerted efforts to stand. Much more than 2 hours after foaling is abnormal. Now, a difference here would be our really big foals take a lot longer to stand. Colts are slower to stand than fillies. Draft foals in particular can take 3 to 4 hours to get up. But certainly some of the big warm blood foals I've had, they've been really healthy and strong, but it's just taken a bit longer for them to get those big long legs coordinated and underneath of themselves. Those foals I do not mind feeding while they're laying down before they get up to their feet. You should see, again, them starting to pass those first stools soon after they're up, but you won't see them passing urine for about 6 to 12 hours after foaling because they kind of need to nurse to get some volume in before they make urine. So again, there's our happy picture, that foal cuddled up in there, latched on and nursing. So after foaling, you need to get your newborn exam scheduled with your veterinarian, and we're aiming for around 12 hours after that the mare has foaled or the foal is nursed. And this is a thorough exam of the foal. We are drawing blood from that foal to check the IgG levels. We're doing that examination of the placenta, but we're also doing a thorough examination of the mare. And this is actually kind of opposite the order that I do it. I walk in that stall and I examine that mare before I even look at that foal. That tends to keep her from getting too worried about me because I'm a stranger. But if she's got a problem, sometimes I know to anticipate more with that foal. Anyway, the blood test, we're drawing blood from that foal. I also submit CBCs, fibrinogens, and so forth on the baby, but we're going to stall side Look to see if that foal has consumed and absorbed good quality colostrum from that mare. You need to remember, and we can repeat this over and over again, that foal is born with absolutely no immunity, and that foal must nurse this antibody-rich first milk or colostrum from this mare in order to prevent easy susceptibility to infection from any source that he encounters. So this is just what our stall side IgG tests look like. The photo on the right, the bottom of the triangle, that's the foal's dot. This is ideal here. We want to see this dark blue color that's darker than what's in the upper right corner. Okay, so this is a placenta laid out. I don't always get them this intact, but sometimes when I'm there attending the foaling, I get this lucky. But again, so here's an entire placenta laid out, and it's kind of describe what's happening inside the mare. So this is the amnion, and that foal is lying within this amnion. So there's foal, there's fluid, there's the umbilical cord that's attached to the foal, and it comes through here. So we've got amnion, we've got another bunch of fluid, the allantoic fluid, and then we've got the allantoic surface of the placenta, and then this is the chorionic surface. And so our umbilical cord attaches between all of these. So this is this chorionic surface. So this is the surface that attaches to the mare's uterus. This is where the nutrient exchange occurs, the oxygen exchange. And again, this is when there's a red bag delivery, you're going to see this first rather than that white amnion. Here's just a close-up picture of the end of the umbilicus on the placenta side. So those are those three vessels. And then this is just a hippomane, which it's just kind of delivered with the foal. It's kind of a gee whiz, and we always think it's extra good luck. So this is the reason for examining the placenta. So this placenta, this was a delivery that I attended because we had concerns about this mare. And so I was there for the delivery. I looked at this placenta, and this is what we see. So this is a big bunch of brown gook sitting on the placenta. This is fairly normal surface of the placenta over here, although it's probably a little darker than a lot of us will see. Anyway, so a placenta that looks like this means I'm going to start treating that foal right now rather than waiting for him to develop a problem. So this was that foal. So this foal was delivered at 315 days of gestation. So that placenta was the source of his early delivery. The mare started dripping milk well before her due date. There was an ultrasound done where I could determine that the placenta was thick. We started treating the mare and then watching her closely. But, you know, lucky for all of the recognition of the problem and recognition of dripping milk before she should have, 315 days, this foal's completely normal with no signs of prematurity. He is easily holding himself up in sternal position here, normal hair coat, normal ear tone, everything completely normal on him. This guy, he was just treated with antibiotics because of her placenta right off of the bat and monitored. He showed no ill effect. And this was actually a thoroughbred foal that went on to have, sell as a yearling and had no issues doing his intended career. So Candace had asked me to kind of talk about my specific protocols. And this is something that you should probably develop on your own with your veterinarian. So if you're not my client, not my patient, I'm not supposed to recommend meds for you. So, but this is what I tell my clients. So my foaling protocol, so that mare has foaled, we're going to dip that navel as soon as that umbilical cord breaks, and we're going to tie up her placenta to keep her from stepping on it. We're going to start rubbing on that foal with dry towels if the mom's okay with that. Once she drops that placenta, you want to gather it up and save it for an exam. And this is when I'm going to give her Banamine. And the reason I give Banamine to all of my mares after foaling is that it decreases inflammation. It helps prevent swelling. It helps to keep her comfortable so that we can keep her eating and passing manure. After pushing that foal out, passing manure can be a very painful thing for her. And if we can assist that process, we can help prevent colic or impaction with that mare. Also to that end, I want to feed that mare wet feeds to help serve as a laxative or softening, manure softening until she's easily passing manure kind of without groaning. And that can be just food, her regular food that is soaked in water or hay that's soaked. Doing either of that's better than giving bran. Alfalfa hay that is soaked or alfalfa pellets or cubes that are soaked also can get that done. So some of my farms literally, once the mare has licked on the foal, they'll actually have a mash bucket with some form of alfalfa and feed and so forth, put in that stall with her right away to offer. On the foal side of things, when to call. So if that foal's temperature is for 102, you need to remember that foals don't regulate their temperature efficiently. So if that foal was running around outside with his mother and you brought him in and you took his temperature immediately, it might be high. Give him 30 minutes, and then it should be under 102. If you notice that foal not nursing, so these foals sip small meals frequently to start off with. And so you may not notice that the mare is not nursing or that the foal is not nursing, but you just might notice that the udder is full. Or she's dripping milk. So if you see that, then you look at the foal, it might be quieter than usual. And what you may see is the foal go to the mare and not nurse, but then she starts streaming. Any indication of not nursing would be a reason to take the foal's temperature and then call your veterinarian. Rapid, shallow breathing, especially when the foal's standing, coughing or nasal discharge, navel issues. And so the navel stump, you should not see urine coming out of that stump, and it shouldn't be swollen. So especially when you're dipping it that twice a day for this first 3 days, it should be getting smaller each day. So if all of a sudden it's bigger, that would be a reason to call. Lethargy or bacteria activity behavior that's less than normal. If you've got a super active foal or one that jumps around when you're in the stall and all of a sudden it's laying around not paying any attention to you, take a closer look. Diarrhea, especially if it persists beyond that kind of foal heat period about a week after they foal, or if that diarrhea is rather profuse, if it's watery, if the foal has a fever associated with it, or colic, any kind of colic symptoms at all. Swollen joints or limbs or lameness, or all reasons to call your veterinarian. So I just wanted to show a video of this is a healthy foal sleeping. And there is, when we talk about respiratory rates in foals, it's really rapid when they're laying on their side, but it should not be this rapid when they're standing up. So just if you notice how fast the excursions of those lungs are. I know that's a pretty quick video, but just remember they breathe a whole lot faster when they're laying down than when they're standing up. I like to constantly kind of assess the behavior of the pair, the mare and the foal, and to make sure that she's doing her job well. Sometimes early indications that there's a problem with the mare may be that we're seeing that she's not paying attention to the foal as usual. So this is a foal who was just born, so he's got her nose right on him. And this one, now we're outside and that foal is right beside her and she's in alert mode. This is all, again, normal behavior. This slide, I just wanted to kind of throw in a couple comments. When you're handling the foal, remember how I talked about not grabbing it around its belly. So when I talk about belly, I mean right here in front of the stifles. I don't want you to grab the foal back here in concern for the bladder. This is where we want to do a hand on the chest and a hand on the butt. And then this foal, I'm actually demonstrating how you could handle it for its blood to be drawn. So you've got the tin is on the elbow. and I'm reaching toward the foal's ear, keeping my hand away from the jugular vein, which is where that needle needs to go. I probably had my hand on the foal's tail and the foal went to sit down, so that's why I moved it here. These are my favorite little foal blankets because they've got Velcro here and across the belly, and they tend to not get their legs caught quite as much. Now, I know we've probably exceeded that time, but if anybody wanted to stick on, this is a video of a normal mare foaling, and it's a maiden mare. And what this video demonstrates that I wanted to share was all the noises that she makes, kind of the progression, and how they will frequently kind of get up and lay down a little bit, helping that foal position. So Candace, you just stop me if we're too far over, but I'm just going to go ahead and click on this video, and then I will hang out for any questions that you guys want to do, or you can email them to me.
Okay.
So the other thing I'll say is this mare's tail is not wrapped, so you can't see the very beginning of the amnion kind of poking through. But if you look at her tail, you'll see movement that tells you that the foal is starting to come through.
And perhaps while we watch, maybe you can entertain a question if somebody has one as well.
Sure.
I actually have a question. We were just talking about this last night about NI, and we were wondering if you needed to test for that with maiden mares.
Typically, no, unless you know that you've got a contrary blood type. So, standard-bred breeders probably do, even with the maiden mare. There's that amnion starting to move there, but the maiden mare has not had exposure to other blood types, so usually that is not a problem.
Okay.
Yeah,
Okay.
so she's pushing pretty hard, and we've got the amnion coming through. You can see there's a foot there. So I'll frequently have people concerned about how much effort is happening here. This is very normal. And what she's getting ready to do right now is normal. She's changing position, laying back down. They may get up, they may turn around, they may get up several times.
Dr. Boyd, we had another question. What are your thoughts on giving ivermectin to the mare right after birthing to prevent heat scours?
So I actually, part of my practice protocol is I give ivermectin when I do the pre-foaling vaccines and within 24 hours of foaling. So I don't think that it actually prevents the scours, but what I'm trying to do is prevent a lot of parasite eggs in that foal's environment. That foal is going to be eating his mother's poop pretty quickly. Also nursing on everything in the stall that might have parasite eggs. So the mare at the end of the pregnancy is probably shedding more larvae eggs, even with a good deworming program, than normal, just because of the stress of pregnancy. But ivermectin is definitely recommended within 24 hours of foaling, but it doesn't need to be given immediately upon foaling.
I actually have another question. If you are, certain that you have some type of dystocia, like, the head's coming out with no legs, and you need to call for help, what should you be doing in the meantime?
So sometimes I'll tell somebody to get that mare up and get walking her. So that can kind of help slow her down. So if you've got a head coming out without feet, the other thing, it's distressing, but the thing also to remember is the umbilical cord is attached. There's still oxygen going to the foal. but you're gonna need help getting those legs organized or the foal's not gonna come out. The other thing, if you've got extra hands on deck, if there's a complication that you can't manage, making sure that your truck and trailer is hooked up or transport if you need to move your mare is also a good idea to have done ahead of time. But literally getting her up and getting her walking and distracting her can be helpful.
Well, thank you so much, Dr. Boyd. I really appreciate it, and I think everyone really appreciates your sympathetic presentation, you know, very sympathetic for the mare and the foal and the process and all of your years of experience.
Thank you. Again, it's part of my favorite thing, so we always hope for a good outcome. And thank you all for having me, and look forward to hearing from you in the future.